Okay. So today we're going to look at the neck area. Okay. The anterior neck and the lateral neck. So look at the models. So we have. Okay. So this is the anterior neck, and this area is the lateral neck. Okay. As you can see. So anterior neck and lateral neck. So you have this skin, and beneath that we have superficial fascia, just like the same structures that we talked about in the face and the other areas. And then we have structures located in the superficial fascia, which is like the cutaneous nerves. We also have cutaneous nerves over here too, just like we had cutaneous nerves in the facial area. We looked at that. And then also we have the veins located in the superficial fascia. Now, other interesting thing about the neck is that you have the superficial fascia and the structures located inside the superficial fascia. And then we have the deep fascia. So one of the difference of this architectural structure in the neck is the presence of a deep fascia. So we do have these. So these superficial, the deep fascia, basically, we have. So we have like layers, all fascia that is made out of deep fascia in the neck area. So the structures are what? Compartmentalized. Okay. So deep fascia we have what? Who can tell me? One, investing fascia, good, and the other? Pretracheal, prevertebral, and carotid sheath. Okay, so we have these fascias. So, so the investing. Okay, we're going to look at the superficial fascia, but in the investing fascia, basically covers this is sternocleidomastoid muscle. Right, it covers sternocleidomastoid. It basically covers from the outside and also from the behind, from the inside. It also covers. It goes to the back. It covers the trapezius. Okay, so here it covers the sternocleidomastoid in the front, and it covers the trapezius, both the back and the front. Okay, so that's investing fascia all the way to the back and the front. So that's the first layer of the deep. The second layer is the pretracheal, right? Pretracheal. So when we have a cross section, so that pretracheal it basically covers what? Covers the trachea, right? Trachea and the thyroid gland. Thyroid gland is basically located on either side of the thyroid cartilage of the larynx. Okay, and then we have trachea. Okay, and behind trachea is the esophagus. So that's the pretracheal fascia. And also pretracheal fascia also covers the neck muscles like the omohyoid, okay, like sternohyoid, all right? Sternothyroid, sternohyoid, omohyoid. So all these muscles, the neck muscles, which are the infrahyoid muscles. So also these are basically covered by the pretracheal fascia. And last fascia is what? Prevertebral. Well, it's not the last, but the fascia that is located posteriorly is the prevertebral fascia. So prevertebral fascia basically covers the right. It covers the deep back muscles. Okay, the deep back muscles, levator scapulae, and the deep back muscles, which are associated with the spine, which are associated with the vertebra. So why are these important? These are important why? Because if you have an abscess or infection, so this is also basically all this organization is to protecting the spreading of the infection from one place to the other, and it protects the structures. So if you have an injury on the neck, and that injury creates an infection, that would basically it could be localized in that specific area. Why? Because you have these fascia basically covering structures, so it's very difficult for that infection to diffuse to the other areas of the neck. But so which area is is deficient of protection is the retropharyngeal space. Okay, and also, so I didn't go into detail in the lecture, but there's also like danger space too. So there's two spaces which are really important, retropharyngeal and danger space. So retropharyngeal space is between the pretracheal and prevertebral. Okay. So retropharyngeal basically goes all the way from the base of the skull, and then all the way it goes to the upper part of the mediastinum, upper part of the mediastinum. So that's the retropharyngeal space. So if you have an infection, like infection or abscess or some other kind of pathology, that could spread to the base of the skull, from there to the brain, or from the brain to the mediastinum, or from the mediastinum to the brain. Okay, so this is what retropharyngeal space, and just behind retropharyngeal space there's a danger space. I didn't really talk about this in the lecture, but this danger space also, this basically space goes further down, all the way to the diaphragm. So that's why they call it danger. Why? Because it has this course that is closely associated with all the mediastinal structures, like the posterior mediastinum, the heart, and the blood vessels, and it goes all the way to the diaphragm. And if there's something wrong with the diaphragm, if there's a hemorrhage in the diaphragm, so that infection would basically, or the cancer tumors cells, tissue, would spread, would follow that danger space. It would go all the way to the base of the skull, and from there it would basically spread to the brain itself. So we have two important spaces there. Behind the pharynx, we have retropharyngeal space, and then we have the danger space. Okay, why is it important? It's important because like if you have a toothache, if you have a tooth infection or tonsillitis, okay, so like nasopharynx, the upper nasal infections, or infection of your tooth, okay, so that also can follow that passage, and that would also so go to your heart, and it would produce like infection of the pericardium, which basically covers the heart. Okay, so that's a spreading route of areas located in the neck. So that's the clinical aspect or application of those layers, fascia, and spaces. Okay, so let's look at the superficial fascia. So in the superficial fascia we have the superficial or cutaneous nerves, and these cutaneous nerves, everybody look at the model. Those cutaneous nerves, in there reach the areas of the skin located anterior lateral of the neck, column. Neck is called the column. So what are these? And basically this comes out or exits at the lateral mid part of the sternocleidomastoid muscle. So what are those? Okay, let's look at these. So one, we have the lesser occipital, and then we have the greater auricular, then transverse cervical, and then this supraclavicular. Okay, let's count again. Lesser occipital, greater auricular, transverse cervical, and supraclavicular. So lesser occipital supplies this area here, the occipital area. Okay. The greater auricular supplies part of the parotid, the ear, the greater auricular. Transverse cervical supplies the mid part of the neck. Okay, both lateral and anterior. Transverse cervical, as you can see. Supraclavicular, they have three branches. That one goes anterior, one goes middle, and then the other goes towards the shoulder area, around the clavicle. So wherever you see the clavicle, you see this